healthcare system is complicated, it's fragmented, and this is our attempt at helping to bring that together to make it clearly understood. I think most people can think of a time that they or a loved one came into a medical system and didn't know what to do next.
Navigating the health system is never easy, even when you're involved in the health system.
It could be 6 months to get an appointment.
You come in, you get this diagnosis, or you get a new med, and you think you know what the doctor said, you're understanding it, and then you leave. And maybe your spouse asks you what happened and you're like, not sure that I remember. They don't call, they just don't take their medication. And by the time they come back to see the physician next, they're probably sicker. Maybe they went to the ED and now we're going backwards. What we're talking about is someone who's using the ED maybe for their primary care. So that was really the problem definition. Were too many ED visits, not following through on the care that's going to make them healthy. The scariest part is when patients fall through the cracks and they don't even know they fell through the cracks. The lack of understanding that our patients have for the care that they are receiving can really lead to poor outcomes.
My dad is a Vietnam vet, injured pretty bad. He isn't a candidate for any kind of surgeries.
When I saw Jerry was in a lot of pain. I just looked at him and I wanted to just give him a big hug. But I knew once we started talking about military service that we were going to find a connection.
Chuck was just the greatest guy. 3 or 4 years ago, we knew that he was on a trajectory of declining health. His heart was failing, and he was seeing physicians in Spokane as well as here in Pullman. It required a lot of visits to the hospital for blood work.
Trying to get through the VA system was the biggest challenge. I gave up because we couldn't find who would advocate for him.
What population health is that we want every single patient in the whole community, whether they come to Pullman Regional or not, to have a clear, understood plan for their care. So for example, a patient might come into the emergency department. What our ED physicians now can do is they can say, this patient has been in here multiple times and they don't have a primary care provider. They have the ability now to send a message to our population health department. What will happen is they will ask them a few questions to really get our team to have a baseline of what they need. Those patients have the opportunity then to ask and really define how much they want us involved in their care. So from there, we're likely getting them back into their primary care. That primary care doctor is then going to make that plan, which is going to include labs. It's going to include likely their preventative care screens. So they may go to imaging. They are also provided with a plan that they can clearly understand and really clear next steps, but they have a partner in our population health department to help walk them through all of that.
We were very fortunate to meet up with Corey Johnson, who was able to offer some alternate treatments that was incredible for him to get some relief.
The more I thought about it, the more I thought, hey, I can get him the x-rays that we need to get. And we were able to spend a few hours taking him in a wheelchair over to the radiology department, getting him checked in, getting him the x-rays he needed, back into our clinic, planning, talking about what our next steps will be in his care.
I mean, none of us really do like needles, but he hated them and he dreaded going. Sometimes he would come home with just these huge bruises on his arm until he found Wednesday at the hospital, the phlebotomist who could find his vein every single time and it wouldn't hurt. He would come home and just rant about her.
I see a lot of patients and that's always my goal. I do everything I can to make sure that they have a good experience and that they do go home to their family and rave about how good their experience was in the lab.
To have him make that relationship and know that he could go there and see her, it really made all the difference in the world for him.
It warms my heart. Being able to be such a big impact it's nice.
Corey and his team were phenomenal. They connected right away. They made him feel comfortable. Trying to really get to know him and show a genuine interest, I think that made all the difference in the world. I had kind of given up previously because I had no one to talk to about it. I didn't know who to go to. At Pullman, I didn't have to look very far. They found me. They really started that process for me.
So we know there's a need in our community, and we want to be really responsive to those needs of our patients.
I mean, you walk out of there pleased, comfortable in the medical, comfortable in what you're going to have to do.
We can take the time to be able to relate to the patients and serve them like they want to be served.